Today I'll talk about agglutination test. What is agglutination test? When antigen-antibody reaction occurs between particulate antigen. Please remember, particulate antigen. Whereas in precipitation test, it is soluble antigen. And agglutination is good in detecting antibodies. Good in detecting antibodies. Now, moving on to the antigen-antibody slide agglutination test. There are 5. One is blood grouping, second is RH typing, third one is major cross matching, minor cross matching, and identification of isolate by using specific anti-serum. Now moving on to the tube agglutination test. What are tube agglutination? Tube agglutination test. One is widal, done for enteric fever. Second, Brussels agglutination test, done for brucellosis. Third one is Weil Felix test, done for typhus fever. The fourth one is Paul Bunnell test, done for diagnosis of VB fever, Epstein-Barr virus, which causes infectious mononucleosis. So next are there are 2 tests which are done for primary atypical pneumonia: strep MG agglutination test and cold agglutination test. Strep MG agglutination test and cold agglutination test are done for mycoplasma. Then we have Coombs test. Coombs test is called AHG to detect RH antibodies. Cold agglutination test is done for the detection of Coombs test is also done for the detection of then passive agglutination test. They are also called as latex agglutination test. ASLO, RA CRP. These are called passive agglutination test. Then reverse passive agglutination test for detection of antigen. This is done for detection of H-base Ag. So I want to explain to you more clearer So agglutination test is an antigen antibody reaction. The principle of this test, the antigen is in particulate nature. There are 5 slide agglutination tests. One is blood grouping. Second one is RS typing. Third one is major cross matching. Donor RBCs, recipient serum, minor cross matching, wherein recipients RBCs and donor serum. Then identification isolate in the laboratory by using specific antiserum. Now coming to tube agglutination. These tests are also called as agglutination test for pyrexia of unknown origin. Widal test. Use TOTH, AHBH for diagnosis of enteric fever. Bristle agglutination test for brucellosis. Weil Felix test. It's another example of heteroval agglutination test. Antigen used is a non-motile strain of Proteus, OX2, OXK, and OX19. Paul Bunnell test for the diagnosis of Epstein-Barr fever, which gives rise to glandular fever, infectious mononucleosis. Coombs test is indirect Coombs test and direct Coombs. What is Coombs serum? Coombs serum is anti-human gamma globulin. Take wash O group RBCs, O positive RBCs, add mother serum. Although there is an agglutination, it's not visible. Then add anti-human gamma globulin, there will be agglutination. Direct Coombs test, take cord blood cells, add Coombs serum, there will be agglutination. Direct Coombs test. Now, precipitation test is converted into agglutination by adding, by tagging insoluble antigen onto the latex particle. Example is ASLO, rheumatoid arthritis factor, C-reactive protein. Now, instead of detecting antibody, if you detect antigen, it is called a reverse passive agglutination test. This is done. We code the antibody to detect hepatitis B surface antigen. Then other two heteroval agglutination tests which are commonly done are streptococcus MG agglutination test and cold agglutination test, done for the diagnosis of primary atypical pneumonia caused by mycoplasma pneumonia. So remember, agglutination test is a particulate antigen, good in detecting antibody. IgM plays a major role in detection of antibody involved is IgM. It's a macroglobulin. Side blood grouping, RS typing, major cross matching, minor cross matching, identification isolate in the laboratory for detection of organisms. Widal test for the diagnosis of enteric fever. Bristle agglutination test for diagnosis of brucellosis. Weil Felix test for typhus fever. Paul Bunnell test for antigen uses sheep RBCs, typhus fever. Coombs test, indirect Coombs test, direct Coombs test. Indirect Coombs test is washed O group RBCs, mother serum, and anti-human agglutination. Direct Coombs test, cord blood cells, add Coombs serum, then the agglutination. Latex agglutination test, precipitation is converted into agglutination. ASLO, RA CRP, and detection of reverse passive agglutination in hepatitis B surface antigen. Instead of tagging antibody, we tag antigen, we tag antibody to detect antigen. Other two are streptococcus MG agglutination test for detection of mycoplasma pneumonia antibodies. Streptococcus MG and cold agglutination test. This all you have to suppose to write in agglutination test. Thank you very much.